My name is Yasser. I'm a senior lecturer in pharmacy practice and a specialist antimicrobial pharmacist in secondary care. So today is part 2 of the video of why I moved from community pharmacy into hospital pharmacy. So if you haven't watched part 1 of this video, then I will link it here. And what I briefly said in part 1 of this video is I mentioned the fact that I moved from working in a community pharmacy in my pre-registration year into a hospital pharmacist role once I qualified. The hospital pharmacist role that I went into was a cardiorespiratory admissions pharmacist. The expectations for this role was to work on an admissions ward 8 a.m. to 8 p.m, 3 days on and 3 days off. So I briefly mentioned 2 reasons why I made the move. And the initial 2 reasons that I mentioned were 1, being able to utilize my knowledge of a patient's blood test results and how that would impact the medication that they're on. And 2, working in a multidisciplinary team. So expanding on the second point, because I wanted to say a bit more about that, one of the main reasons that a lot of hospital pharmacists want to become hospital pharmacists is the fact that you have the ability to work very closely with other healthcare professionals. This is great for developing an understanding of other people's roles. It's great for developing communication skills with other healthcare professionals, and it's great for your development as a pharmacist. One of the difficulties in community pharmacy, which is beginning to improve, but there are still those boundaries there today, is the lack of communication with other healthcare professionals and the difficulty of contacting other healthcare professionals. There is so much to learn from other healthcare professionals, and having the opportunity to work closely with other healthcare professionals like physiotherapists, with nurses, with other doctors, is just great for your development. It's great for having an understanding of patient care and to have an understanding of the holistic approach that you need to take with patients. To expand on that further, another reason that I really wanted to get into hospital pharmacy was the fact that you have the opportunity to rotate between different specialities. So you can develop a greater understanding of the respiratory system, a greater understanding of the cardiovascular system, a greater understanding of the central nervous system. You see patients with different comorbidities, so different health conditions, and you have an understanding of what it takes to acutely manage these patients in a hospital setting. The development opportunities from a specialty perspective are great, and at the same time, there are a lot of opportunities for learning sessions within the hospital. There's opportunities for lunchtime learning. There's opportunities to develop your understanding of other healthcare professionals. And there's opportunities to work through a clinical pharmacy diploma. Of course, you have the opportunity to do the clinical pharmacy diploma in community pharmacy. But in many cases, and a lot of my friends would be doing the clinical pharmacy diploma using their own resources if it's not provided to you by the community pharmacy that you work at. So the difference is the fact that there's no expectation for you to do it. There's no structure of how you'll work through that diploma. There's no consideration of the time that's required for that diploma if you're working in a community pharmacy. Of course, there are challenges completing that diploma in a hospital pharmacy setting, but at least you can spend some time with other more senior pharmacists to have ward visits, for example, as part of your diploma. There's an opportunity for you to work closely with other pharmacists, and you can go through what you particularly struggle with your diploma. You can discuss the possibility of development opportunities and where you want to go in terms of prescribing as well. A lot of hospital pharmacy departments now are very keen on ensuring that the pharmacists that are training in that department are independent prescribers. There's opportunity for you to work within different specialties in the hospital and provide your services as an independent prescriber. So I've spoken a lot about the benefits of working in hospital pharmacy. Of course, there are downsides. Of course, there are benefits for working in community pharmacy. And if anyone's interested in the pros of working in community pharmacy, then drop a comment down below and I'll be sure to make a video on that. I hope you found this video useful. If you did, drop a like, drop a comment about any questions that you have about hospital pharmacy, and I'll see you in the next one.